All right, good afternoon. I would like to first welcome all of the grantees attending today's webinar on CDBG CARES Act national objectives. Hope all of you are enjoying the training conference thus far. Next slide. My name is Chris Kizzy. I'm Vice President of Enterprise Advisors, the mission-based consultancy of Enterprise Community Partners. I am joined today by my co-presenter, Rudy Munoz. Rudy is the founder of MDG Associates, a community development consulting firm based out of California. And we are also joined today by Gloria Coates and Julia Nedeker-Gonzalez from HUD Office of Block Grant Assistance. Gloria and Julia will participate in the Q&A session at the end of the webinar. Next slide, please. Today, we are going to summarize the 3 CDBG national objectives. We are also going to review alternative requirements and flexibilities granted in the CDBG CV notice. While flexibilities are granted in the CDBG CV notice, we also want to point out the existing flexibilities that grantees have under the CDBG program. So we will make sure to highlight these when we get further into the webinar. Additionally, a goal today is to provide some time to answer questions and clarify components of the notice addressing national objectives. So please submit any questions you have as we move through the presentation. And finally, this is just one of many trainings and TA products that will be produced related to the CDBG CV program. At the end of the webinar, we will highlight some of the recent resources developed to date. Next slide, please. For the webinar today, we will focus on national objectives, particularly those likely to be used for COVID-19 response. We will discuss documentation requirements, highlight the flexibilities provided for certain national objectives in the Federal Register notice. Then we will get into some of the program design considerations using examples from common CDBG CV activities. And finally, we will have time at the end of the presentation for Q&A. We do have a lot of content to get through today, so just to warn you, we are going to move quickly to make sure we get through all of that content. But please use the Q&A feature to ask any questions, and we will uplift as many of those questions as we can at the end of the presentation. Next slide, please. At this time, I would like to turn it over to my co-presenter, Rudy Munoz, to talk about the 3 CDBG national objectives.
Great. Thank you, Chris. Good morning to some of you. Good afternoon to others. As Chris indicated, one of the objectives of this webinar is to provide you with an overview of the 3 CDBG national objectives. Next slide. In order to be eligible for funding, all CDBG activities must be eligible under the regulations, as well as you as a grantee, you're required to document how that activity meets one of the 3 national objectives of the CDBG program. The 3 national objectives are shown on this slide and include benefit to low and moderate income persons, prevention or elimination of slums and blight, and urgent need. Of the 3 national objectives, the CDBG statute prioritizes low and moderate income by requiring that at least 70% of the non-administrative CDBG funds be spent on activities that meet the low and moderate income national objective. The national objectives that this presentation is going to focus on include some of the more commonly used national objectives, and those include limited clientele, low mod jobs, and urgent need. However, it's important to note that in many cases, and we'll talk about this further in the presentation, more than one national objective may be available depending on the specific activity that you are implementing. So you as a grantee will have some choices to make along the way. And that's an important part of what we will go over today. I'd also like to bring to your attention that the CDBG CV Federal Register notice, which is listed on this slide, along with a URL link, provides all alternate requirements for documenting low and moderate income jobs. It also provides guidance for documenting the use of urgent need national objective for activities that prevent, prepare for, or respond to the COVID-19 pandemic. During the presentation, we'll focus on national objectives that are associated with activities that are commonly undertaken to prevent, prepare for, or respond to the pandemic. If you need additional information about documenting compliance with a national objective that we do not cover in today's session, we encourage you to refer to the Basically CDBG training curriculum that's available to you through the HUD Exchange website. You can also talk to your local HUD field rep or regional office rep. And you can always, as a third option, you can submit your question through the HUD Exchange AAQ portal. Next slide. So the goal of the CDBG program, as noted in Section 101C of the Housing and Community Development Act, is, and I'm going to read this section out, the development of viable urban communities by providing decent housing and suitable living environment, and expand economic opportunities, principally for persons of low and moderate income. That last part is important, for persons of low and moderate income. And so this overall benefit requirement of targeting funds to low and moderate income individuals also applies to the CDBG-CV program. To comply with the requirements, at least 70% of all non-administrative expenditures must be for activities that meet the low and moderate income national objective. The table that we've provided on this slide compares how the overall benefit will be measured for the CDBG-CV program, which is slightly different from how it is measured in the regular CDBG program. For the regular CDBG program, the percentage calculation is based on the aggregate expenditures over a 1, a 2, or a 3-year period, as specified in your action plan certifications. In contrast, for the CDBG-CV program, the 70% overall low and moderate income benefit requirements is not tied to the formula CDBG activities. It is a separate calculation, remember that, separate calculation that it only measures the CDBG-CV grant expenditures, and that's all CDBG-CV grant expenditures, irrelevant of the tranche that you received it in. For CDBG-CV, the calculation is based on overall percentage of the total CDBG-CV grant. Next slide. So let's go ahead and get started with our discussion of the low and moderate income national objective. Under the low and moderate income, or LMI, national objective, limited clientele activities serve individuals and specific populations. And this could include senior citizens, homeless, and other low and moderate income people, which also includes owners of micro-enterprise businesses with 5 or fewer employees. There are 4 ways to meet a national objective under the limited clientele option. The first is to document that at least 51% of the participants are persons whose family income does not exceed the LMI limit. And a simple, verifiable self-certification is acceptable. And HUD does provide a sample self-certification form that's available within the CPD income calculator within the HUD Exchange website. Keep in mind, and I mentioned this earlier, while 51% of the participants must be low and moderate income, That means that the remaining 49% of the participants may earn incomes above the moderate income level. This provides you with some flexibility in your program design, where it might be important to provide services like health services to an entire group of people, rather than just the ones that are low and moderate income. The second option is to document that 100% of the participants are low and moderate income. Depending on your program design, this might be appropriate for activities such as a public service emergency payment for rental assistance program. The third option is the presumed benefit option. This option is another way to meet the low and moderate income limited clientele national objective. Under this option, you would have to document that 100% of the participants are members of groups that are generally presumed by HUD to be principally low and moderate income persons. These 8 presumed groups are listed on this slide. So if you need to refer to that list or look at that list, it's available on this slide. So if your program design to prevent, prepare for, or respond to COVID-19 targets services that are exclusive to one or more of these groups, you can use the presumed benefit option to meet the LMC national objective. And finally, there are situations where you can meet the national objective by documenting that the nature and location of the activity is such that it could be concluded that that activity's clientele will primarily be low and moderate income persons. As an example, you could be providing internet access as a public service to the residents of a low income affordable housing development, so that the children that live in that development can attend school online and prevent community spread of COVID-19. In this situation, you can document that all the residents of that complex are required to be low and moderate income to demonstrate the nature and location option. Next slide. Next, we'll discuss the low and moderate income jobs national objective, or LMJ. Under the low and moderate income jobs category, activities provide economic opportunities through the creation or the retention of permanent jobs, at least 51% of which will be made available to or held by low and moderate income persons. Generally, you use the LMJ category in conjunction with activities that support businesses, such as a small business grant or loan program, that provides working capital so that it can assist businesses that are coping with temporary closures or reduce foot traffic. And many of you are implementing this type of a program. In exchange for the financial assistance, the business then agrees to create jobs or retain existing jobs that would be lost but for the CDBG, CV funds, or loan. For LMJ, at least 51% of the jobs created or retained must be held by low and moderate income persons. And you calculate that based on full-time equivalent positions, or FTEs. And just as an example, if a person works 20 hours per week, that job would represent a 1/2 FTE, or full-time equivalent. Next slide. For jobs, sorry about that. So let's go over the required jobs to be considered created or retained. For jobs created as a result of the CDBG assistance, it must either be held by or made available to low and moderate income persons. For jobs that are retained as a result of the CDBG assistance, the grantee and the business must show that the existing jobs would be lost without the provision of the CDBG assistance. So in this case, a job loss would occur if either the company would have gone out of business, if there was a drop in workforce that would have cut the job, or let's say if the company moved from the area where it could be documented that they could not reasonably be expected to keep their job. Of the retained jobs, 51% of those jobs must be currently held by low and moderate income persons, or the job is reasonably expected to turn over in the next 2 years, and there's documentation that shows that it will be filled or made available to low and moderate income persons. Next slide. A job may be presumed to be low and moderate income if one of 3 conditions, as noted on the slide, are met. And to facilitate the use of funds for economic development that prevents, prepares for, or responds to the COVID-19 pandemic, the Federal Register notice removed the higher poverty rate that is required in some cases for central business districts or CBDs, which is not required by statute. The location-based presumptions that are listed on this slide that apply for job creation or retention include if the employee resides in a census tract or block numbering area, or what we call BNA, with 20% poverty and general distress, or if the employee resides in a census tract block numbering area with 70% low and moderate income, or if the business or job is located in a census tract block numbering area with a central business district with 20% poverty and general distress. Next slide. Next, we'll discuss the urgent need national objective. Urgent need is used to address emergency situations. Typical activities could include public services for non-low-mod income clientele, such as mortgage assistance or health services to address serious outbreak. Quick note regarding mortgage assistance for non-low-mod individuals. Keeping in mind that income qualification is not required under urgent need, it's possible for a grantee or a state to use a portion of their allocation to provide emergency grant payments made directly to service providers for subsistence type payments, such as rent, mortgage, utilities, for clientele earning more than 80% of the area median income, okay? All of the conditions required for use of urgent need still apply. And Chris will discuss this further in the documentation options slide for urgent need. And of course, remember that grantees and states must still meet the 70% overall low and moderate income benefit requirement. To meet the urgent need test, you must demonstrate that the existing conditions pose serious and immediate threat to health, safety, and welfare of the community. The CDBG CV Federal Register notice establishes some specific guidance to appropriately document the use of urgent need national objective. So if you are using the urgent need national objective, I highly recommend that you look at the Federal Register notice under that section of the Federal Register notice. As a reminder, when using urgent need, make sure that you're accounting for duplication of benefits and that you are considering other funding sources. Things have changed from day one to current day. So look at what other funding sources are available, or consider using an alternate national objective. Next slide. Okay, now I'll turn it back over to Chris, who's going to discuss options for documenting compliance with certain national objectives. Chris?
Thanks, Rudy. Next slide, please. In this next section, we will review options for documenting compliance with the 3 national objectives, including limited clientele, low mod jobs, and urgent need. So this chart summarizes the compliance requirement, the documentation standard, and the options for grantees to demonstrate compliance. In terms of limited clientele national objective, there are 3 ways to document compliance. First, you can document that at least 51% of the participants are LMI. The remaining 49% of beneficiaries may be of any income. This flexibility is already part of the CDBG program and is not unique to CDBG CV. Under the LMC national objective, where information on family size and income is the documentation standard, a verifiable self-certification form may be used to document that at least 51% of the beneficiaries served are low or moderate income. Grantees may also require source documentation of income if that is their preference. Some grantees use self-certification for activities that provide services that have a relatively low dollar value per capita, like bagged groceries, and require full source documentation for activities that have higher dollar values per capita, like emergency payment programs that cover rent payments, for example. For self-certification, Rudy noted that HUD provides a sample form as part of the CPD income calculator. When you log into HUD Exchange, go to the income calculator and start a new CDBG calculation under the load mod limited clientele national objective. Once you enter the family size and some of the other information about the location, the calculator will tell you the applicable income limit. And then it takes you to a screen where it tells you the self-certification may be used. Click next and it will take you to the screen where you can download a PDF self-certification form. And you can download that form and use it, or design your own similar form to facilitate a self-certification in your program. With self-certification, the beneficiary signs off on their income at the time of assistance, certifying that the information they are providing is true and correct. The certification includes that the applicant agrees to documentation of all income sources to the HUD grantee or program administrator for verification upon request. Each of the adults covered by the certification must sign and date the form. There is some risk with using self-certification if a beneficiary is later audited and determined to be over income, particularly if your program as a whole is cutting it close to, in terms of meeting the 51% standard. A question we get a lot is who performs the auditing and how do you verify the self-certification? So HUD's expectation is that grantees or states establish reasonable policies and perform a reasonable level of sampling to collect source documentation from individuals or families to confirm their certifications. The size of the sample is really up to you as the grantee, but generally speaking, it should be between 10 to 15% of the beneficiaries served, unless your initial sampling reveals that there are a lot of certifications that are found to be actually over income, and you might want to adjust how you do your sampling. One way to incorporate sampling in your procedures is to automatically request source documentation for every 5th or 10th application that comes in before they are served, so that it is considered random. The second way to document compliance with the limited clientele national objective is to document that all participants served are members of groups that are presumed to be principally low to moderate income persons. For example, abused children, battered spouses, elderly persons, severely disabled adults, homeless persons, illiterate adults, persons living with AIDS, or migrant farm workers. If in order to obtain the service, you must qualify as one of the presumed benefit categories per the intake application and procedures of the subrecipient, then that can be the documentation. It is important to remember here that you can't mix categories. So even if one beneficiary of the activity isn't a member of one of these groups, you can't use presumed groups for the CDBG activity because the regulation says all participants served are members of presumed groups. You can have a mix of the presumed groups together, but all participants must fall into one of those groups in order to make this work. The third way to comply with LMC is to document that the nature and location of the activity is such that it may be concluded that the activity's clientele will primarily be low to moderate income persons. For example, grantees can document an organization's mission or its operating procedures, which limit services exclusively to LMI population. A typical approach to choosing LMC category is that depending on the beneficiaries to receive services in their location, evaluate presumed groups and nature of location first to see if one of the options works, which is a lesser documentation burden. If neither are a good fit, you will need to use income certification to meet the minimum 51% standard, and will have to establish your policy approach to accept self-certification or require source documentation of income. Next slide, please. HUD established an alternative record-keeping requirement designed to expedite assistance to coronavirus-affected businesses. The normal job creation and retention record-keeping requirements consider family income when determining whether a job holder or a job seeker is LMI. But these requirements are likely to be burdensome during a time when unemployment has surged, as we have experienced over the past year or so, and family income is more difficult to document. And so the collection of income information directly from assisted businesses can help streamline the assistance. The alternative job creation and retention record-keeping requirements under CDBG CV include grantees and employers may consider individuals that apply for or hold jobs to be members of a one-person family for activities that prevent, prepare for, or respond to the coronavirus. Grantees may substitute records showing the type of job in the annual wages or salary of the job in lieu of maintaining records showing the person's family size and income to demonstrate that the person who filled or held or retained the job was a low to moderate income person. HUD will consider the person income qualified if the annual wages or salary of the job is equal to or less than the Section 8 low income limit established by HUD for a one-person family. Next slide. For each business, for jobs to be considered held by LMI, the business must supply documentation of income of the people that are hired or evidence of a qualifying presumption. Grantees should use a written agreement to enforce the requirement to document that jobs are held by LMI persons. 51% of the actual FTE jobs filled must be held by LMI individuals. In each of these situations where you need to document the income of the employees, the business should be required to provide that documentation and may obtain it from an employee or candidate for the job using a self-certification form. For jobs to be made available to low and moderate income persons, HUD expects that grantees' emphasis to be on the process of the hiring rather than the actual person hired. So the grantee must prove that for created jobs, no special skills or education beyond a high school level are required, or if a special training is required, that the business will provide the appropriate training to that person. A grantee may also show that there is a process for ensuring that low to moderate income persons will get first consideration for jobs created as a result of the CDBG assistance. This might include an interview process that begins with candidates from a job training program or other programs that ensure the first opportunity to fill these jobs is given to a low to moderate income person. A grantee should use, again, a written agreement with the business to spell out the first consideration process and the job classifications for the positions created or retained. In addition, the grantee must monitor the business for compliance with the agreement. Next slide, please. So there are several ways to document that a job is held by or made available to LMI. The regular CDBG requirement, which is to document the family income of the beneficiary. The alternative requirement that allows you to document the individual income of the beneficiary and evaluate that income against the limit for a family size of one person. And then the alternative requirement allows grantees to work with the business to document that the type of job and annual wage or salary for that job is equal to or less than the Section 8 low income limit for a one-person family. And then the location presumption method, which we will discuss in a moment. So the alternative requirement allowing for documentation of the individual's beneficiary income rather than the family income really reduces the documentation burden because information about the income of the other family members is not necessary, and the income of the employee can generally be verified through the business. The alternative requirement, counting a job as LMI based on the annual wage or salary of that position being less than the 1% LMI limit, substantially reduces documentation burden by allowing grantees to work only with the assisted business to document compliance rather than having to obtain self-certifications from each individual employee. Next slide, please. So in addition to the methods we just discussed, and Rudy touched on this earlier, a job may be presumed to be held by or made available to a low to moderate income person if the employee resides in a census tract or BNA area with 70% LMI, or the employee resides in a census tract BNA with 20% poverty and general distress, or the employee resides in a census tract BNA with a central business district, 30% poverty and general distress, and the business and job are located in the census tract BNA with a central business district, 30% poverty and general distress. In the alternative requirement provided by HUD in the CDBG CV Federal Register Notice, the business and the job are in a census tract BNA, including an area within a central business district with 20% poverty and general distress. Effectively, HUD eliminated the higher poverty requirement applicable when the business and the job are located in such an area. So we've mentioned a couple of terms here that should be defined. A central business district is an area of very high land valuation characterized by a high concentration of retail businesses, service businesses, offices, theaters, hotels, and by very high traffic flow. The term general distress typically means all block groups in the census tract have poverty rates of at least 20%. The specific activity being undertaken is located in a block group that has a poverty rate of at least 20%, or upon the written request of the grantee, HUD determines that the census tract exhibits other objectively determinable signs of general distress. And I just want to point out that the location-based presumptions for low-mod jobs simplifies the task of documenting compliance by increasing the number of areas in a jurisdiction where the presumption may apply to the employee or the business and the job. Grantees interested in using the location-based presumption should pull down the LMI data and poverty data to map out the areas of their jurisdiction that qualify in order to determine if it makes sense to use the location presumption. Next slide, please. And finally, urgent need. Grantees may use the urgent need national objective as a component of their CV program. In considering urgent need, grantees must answer 3 questions. 1, is the activity designed to alleviate existing conditions that are recent or recently became urgent within the last 18 months? In answering this question, grantees can demonstrate that the activity is preventing, preparing for, or responding to the coronavirus. 2nd, does the condition pose a serious and immediate threat to health and welfare of the community and is of recent origin? In answering the 2nd question, grantees may refer to the HHS Public Health Emergency Declaration, the Federal Disaster Declaration, or a referral to the grantee state or local disaster emergency declaration. And then finally, the 3rd question, is the grantee or unit of general local government unable to finance this activity on their own and other funding sources are not available? In answering this question, given the extreme pressure on local and state government budgets, documentation of tieback to COVID-19 and compliance with the duplication of benefit requirements, showing that no financial assistance has been received or is available to pay costs may satisfy this requirement. All right, next slide, please. And now I will turn it back to Rudy, who will discuss options for choosing the appropriate national objective.
Thank you, Chris. Next slide. So as I indicated earlier, there are many activities in the CDBG program that are compatible with more than one national objective. So choosing a national objective involves considering a number of factors. These would include determining which national objective or objectives are compatible with the eligible CDBG activity that you are undertaking, determining the actual beneficiaries or who the end users are of the activity that you're undertaking, considering the documentation requirements associated with the available national objectives. Certain ones require more documentation and longer periods of documentation, so keep that in mind. And selecting the national objective that best represents the activity's benefit to the community for which adequate documentation is readily available or is most likely to be obtained. Next slide. So in the prior slide, I mentioned that when you're selecting a national objective, there are a number of factors that you want to consider. On this table, we provide an illustration of the primary considerations and the best choice for an activity that provides emergency payments on behalf of individuals and or families. By selecting the limited clientele option, you can serve people earning above the moderate income limit if at least 51% are low and moderate income. So as an example, if a program serves 1,000 people and at least 510 of those people are low and moderate income, the activity would meet the LMC national objective. The other 490 people who are assisted could earn above the moderate income and the activity would still qualify as LMC. Next slide. So on this slide, we list an activity that proposes to provide technical assistance to owners of microenterprises or persons that are forming a microenterprise. If you're to look at the likely national objectives that are listed on the left side of the table, you'll notice that it mentions HUD Matrix Code 18C, and you would see that there are several possible national objectives to choose from. In this scenario, the selection of a national objective would depend on the situation. So first, we'll look at LMC as an option. So use LMC when it's likely that you can document that the owner or persons that is forming that micro enterprise is low and moderate income. There are existing provisions in the regulations for LMC that allow for micro enterprise owners and persons that are forming micro enterprise to continue to qualify for up to a 3-year period once you're initially established to be low and moderate income. Section 570.208A2.3 reads as follows. I'm going to read this. A micro enterprise assistance activity carried out in accordance with the provisions of 570.2010 with respect to those owners of micro enterprises and persons developing micro enterprises assisted under the activity during each program year who are low and moderate income persons. For purposes of this paragraph, persons determined to be low and moderate income may be presumed to continue to qualify as such for up to a 3-year period. If we look at the option for LMJ, you would use this option if the owners or persons that are forming the micro enterprise are not low and moderate income, but they are willing to commit to creating a number of jobs. And in this case, at least 51% of the jobs would need to be low and moderate income. For jobs, remember that there are some new flexibilities allowing grantees to substitute records showing the type of job and showing that the annual wages or salary of the job is equal to or less than the low income limit for a 1-person family. This is a flexibility that should be looked at by all of you. And finally, we'll look at urgent need as an option. And in this situation, we look at a small micro enterprise business that plays a role in providing food, supplies, or essential services to a community. And it's a situation where time is of the essence to prevent, prepare for, or respond to the COVID-19 pandemic. And it may make sense to go with urgent need as a way to expedite the assistance and get small establishments open. Note that HUD provided some clear and attainable documentation standards for urgent need in the Federal Register notice. The potential downside here is that you need to make sure that you're managing your grant carefully so that you continue to meet the 70% benefit test. Next slide. In this next example, you'll see that the eligible activity is proposing to provide CDBG CV funding to provide COVID-19 testing to the residents of the community. If you were to look at the possible compatible national objectives for health services, or matrix code 05M as listed on the left-hand side of this table, you would see that there are several possible national objectives to choose from. In this scenario, the selection of the national objective, again, would depend on the situation. In this particular scenario, we have health services, which is an activity where the best choice of a national objective is going to really depend on the actual situation at hand. LMC can be used in several ways. It'd be appropriate in situations where the activity that is providing the health services exclusively serves the members of presumed groups. And we talked about those in earlier slides. And this would include things such as testing activity that is restricted to seniors and disabled adults. LMC could also be used in the nature and location of the activity. Primarily, if the beneficiaries are primarily low and moderate income, such as programs that are operated by federally qualified health centers, such as community health centers, migrant health centers, and healthcare for the homeless. And finally, LMC can be used if those being tested provide a verifiable self-certification of income. And Chris went over that self-certification of income documentation already in a prior slide. Remember that if you go the income verification route, at least 51% of the beneficiaries must be low and moderate income, whereas the other 49% may be above moderate income. The existing regulations provide you that flexibility. The next option that we're going to look at is the low mod area, or LMA. LMA would be appropriate if the testing is available to all the residents of an area that is low and moderate income, and it is primarily residential. And finally, we'll look at the option of urgent need. Urgent need would be appropriate if the overriding consideration is that everyone that is tested, without regard to their income level, without regard to membership in a presumed group or where they live. To address the 70% overall benefit test, either the LMC or LMA national objective would be the best choice. But again, it's not the only choice. We have, in many of these activities, we have multiple options. Choose the one that best meets the type of activity that you are implementing and the situation. Next slide. Okay, I'll turn it back over to Chris, who will discuss the various resources that are available to you.
Thanks, Rudy. Next slide, please. So by now, I'm sure you have already found and reviewed the Federal Register notice that was published last August. As a reminder, you may submit questions regarding the CDBG CV program to the ongoing AAQ. There are several CDBG resources posted to the CDBG CV site within the HUD Exchange, including the links to the AAQ that are on the slide, the CDBG CV notice, FAQs, and duplication of benefit guidance as well. The basic, at least CDBG manual, provides a good foundation of knowledge for local professionals who are a little newer to the CDBG program. So I would encourage you to look at Chapter 3 that details the national objectives for a stronger foundation on national objectives. And then also on the slide is the link to the CPD income calculator, which we've already talked about using to generate a self-certification form to support self-certification for your program. Next slide, please. There are a couple of newer resources that are currently available that are linked on this slide. To broadband, quick guides, duplication of benefit, economic development, financial management, public facilities improvements with CV, and the state CDBG CV implementation, as well as a webinar series that outline the topics listed on the slide. So just would encourage all of you to access this information, review it at your leisure, because I think it provides an additional wealth of knowledge and resources to support program implementation. All right, so next slide. Okay, so I think we've entered the Q&A portion of the webinar, and let's see if we have any questions from the Q&A.
Yeah, Chris and Rudy, thank you so much for going over so much content so quickly and so clearly. We have gotten a number of questions in the Q&A pod. First, I just wanted to give one general announcement. There were a couple of questions asking about CAPER reporting for CDBG CV. And I wanted to remind everyone that at 3:20 p.m. Eastern Time today, there is a session on accomplishment reporting in IDIS for CDBG CV, which will answer many of your reporting and CAPER questions. So just wanted to remind everyone that that is coming up in a little bit. The first question, and Rudy, I'm hoping you can respond to this, is asking about the 70% overall benefit. Can you provide an example of how I would calculate the 70% overall benefit for CDBG CV? Is it calculated separately for each CDBG CV award, or is it calculated together?
So in response to your question, the 70% overall LMI benefit test applies specifically to the CDBG CV grant, only the CDBG CV grant. If you remember on one of our slides, we talked about the CDBG funds being separate from your regular CDBG funds. However, you must treat all, I repeat that, all of your CDBG CV allocations or tranches of money as a single grant, and then perform your 70% calculation. So as an example, if you received, let's say, $250,000 in your first round of CDBG CV allocations, and then received an additional $750,000 in the second round or second tranche of the CV allocations, you would have a total of $1 million in CDBG CV grant funds. Once you were to spend that $1 million, you would conduct your 70% overall benefit test. And basically what you would do is take all of your expenditures, you would subtract your planning and administrative expenditures from the total expenditures. Remember that planning and administration expenditures do not have to meet a national objective or do not address a national objective, and therefore are not part of that calculation. So if we use the numbers that I just mentioned, let's assume that you spent the full 20% or $200,000 on planning and administration costs. That would mean that the 70% overall benefit test would be applied to $800,000, right? It's $1 million minus the 200,000, leaves you $800,000. You would then do your test, your 70% test on the $800,000, leaving you with $560,000. So under this scenario, you would have to spend a minimum of $560,000 on activities that meet the low and moderate national objective in order to be compliant with the overall benefit test. I hope that's clear.
Yes, thank you, Rudy. Chris, we've gotten a number of questions on nature and location, so I'm going to try to put a couple of them together for you here. When using nature and location for national objectives, can you describe what threshold should be considered for how the activity benefits LMI persons? And can you also just provide an example of a nature and location activity?
Sure, thanks for the question, Chris. Yes, presumed location and nature of activity can be used, and I want to make sure this is clear, when it may be reasonably concluded that the activity's clientele will primarily be low and moderate income individuals. So a common kind of COVID example could include conducting COVID-19 testing and or providing PPE to public housing residents. Given that the activity is taking place in public housing, it can be reasonably presumed that the majority of the clientele are low to moderate income individuals based on the nature and the location of the activity being provided. So that's an example where it's implying the presumption as well as the nature of the activity as well.
Great, thank you so much, Chris. Rudy, coming back to you, we've gotten a few questions on LMJ and the requirements with that. I'm wondering if you could clarify what would be considered as a general distress if you are using the location presumption for meeting the LMJ national objective.
Yes, great question. Pervasive poverty and general distress can be met by meeting at least one of the following standards, and they were on your slides. All block groups in the census tract have poverty rates of at least 20%. The activity is taking place in a block group that has a poverty rate of at least 20%, or upon written request of the recipient, HUD determines that the census tract exhibits other objectively determinable signs of general distress. This could be something such as a high incidence of crime, narcotics use, homelessness, abandoned housing, deteriorated infrastructure, and so on and so on.
Great, thank you, Rudy. Chris, a question for you. Can you describe how one would document a self-certification for income eligibility?
Sure. So within the CDBG program, you as the grantee are able to use a verifiable self-certification form to confirm income eligibility for an activity. So this approach is most commonly used for public service activities. This form is most often provided as part of the application or intake process. And so as we talked about before in the documentation section, a sample self-certification form is also available on the HUD Exchange. Just a reminder when using self-certification though, it comes with a warning label to make sure that you are self-monitoring or sampling a percentage of the self-certifications. Otherwise, it could result in an ineligible project. So make sure your policies, your procedures incorporate the performance of a reasonable level of sampling. And we talked about maybe using a 10 to 15% standard, or having procedures that say we're going to sample every 5th or 10th certification form. So just make sure your policies and procedures reflect the requirements there.
Great, thank you so much. And I think we've got time for at least one more question. Rudy, this is a question for you. We talked through different ways of documenting income eligibility for meeting the LMC national objective. And I'm just wondering if you could review those 3 different ways to document LMC.
Yes. So in one of our slides, we kind of listed the 3 ways to document LMC. The first being 51% of the participants are low and moderate income. Remember, the other 49 can be above moderate income. If all participants are members of groups that are presumed to be low and moderate income, and on the slide, you will be able to see that there are 8 presumed groups. And the third being the nature and location of the activity is such that it may be concluded that the activity's clientele is primarily low and moderate income. And we use the example of the broadband in that multifamily development, where the youth can now access the broadband and be able to attend classes. Hopefully that answers the question.
Yes, thank you, Rudy. And I think that puts us just about at the top of the hour. Thank you everyone so much for joining us. Content will be posted on the conference website after the conference. I know we weren't able to get to everybody's questions. As a reminder, you can submit your CDBG CV questions through the AAQ. Chris and Rudy, thank you so much for sharing the past hour.
Thank you.
Absolutely, thank you all.
Good luck to everybody on your programs.
Take care.